victorious health and wellness from. Today, we're continuing with a segment that not everybody was happy about, but it's called Let's Talk About Sex. And this week's topic is called Gonorrhea. And you may be wondering, why the heck is she talking about sexually transmitted diseases when she's a wellness practitioner? Well, being that I am a wellness practitioner, I'm always concerned with the people's health. And STDs are a significant health concern, and awareness is crucial because we think everything can be treated now. And in reality, we do have many conventional and traditional methods that do help with infections and all kinds of bacteria, but some of these cannot be reversed once we have them, and they can become permanent, and they can evolve quickly within our body systems. And one of them is gonorrhea. Gonorrhea is a sexually transmitted disease that has evolved within the years. Gonorrhea is an infection of the mucous membrane that contains pus. So now all these mucous membranes have pus. The issue with gonorrhea is that it can carry the antibiotic-resistance gene, which makes it very challenging to treat. And often doctors prescribe an antibiotic and it's done and over with. But in this case, not so much. Still, as often that the medication will not be able to suppress or eliminate gonorrhea. We talk about antimicrobial resistance bacteriums in one of our segments, so you might want to take another look at that one, okay? I want you to understand that this is important. The STD can both infect both men and women alike. Like many other sexually transmitted diseases, gonorrhea can infect the penis, the vagina, the anus, the urethra, and the throat. And the most common way gonorrhea is spread is during vaginal and anal or oral sex, okay? Or even through childbirth. So if a woman is infected and she gives birth, the infant can get gonorrhea in the eyes, okay? The infection is mostly common within 15 to 24-year-olds, but anyone who's engaging in sexual activity who's not using protection can get gonorrhea. So persons who are sexually active under the age of 25 should get tested annually for this sexually transmitted disease. So keep in mind that if you're being sexual, there are many risk factors. A sexually active man who is gay or he's bisexual or has sex with men, a sexually active woman who is younger than the age of 25 and doesn't keep a monogamous relationship and has new or multiple sex partners is at risk of gonorrhea. There is absolutely no exclusion on this. If a person does not get treated right away, it can cause severe health problems. So much so that it could affect other body parts, which we're going to talk about soon. For women, an issue that we've seen is scar tissue formation in the fallopian tubes. It causes ectopic pregnancies, infertility, permanent and long-term abdominal pain. And in men, it can cause severe pain in the seminal pipes that are attached to the testicles, and it can cause them to become sterile, preventing him from ever becoming a father to anyone's child. So gonorrhea is not a joke. The infection can be so severe that it can spread to your bloodstream. It could even affect your joints. And not only that, it can increase the risk of transmission of HIV. So if you don't think that you are a risk or that you can get gonorrhea, I'm sorry, sweetie, you need to think again. There's 1.14 million new gonococcal infections that occur every year in the United States. And half of those cases occur within 15 to 24-year-olds. So this is not a joke. And worse yet, like I mentioned before, not all antibiotics are doing anything to this gonorrhea. There are certain strains that are becoming resistant to medications. So let's talk about the symptoms now, okay? If you feel that you have a burning sensation when you're urinating, or yellow or white green discharge from the penis or your vagina, if your testicles feel painful or swollen, and a lot of men don't feel that, or vaginal bleeding between periods, rectal infections in both men and women that include discharge, anal itching, soreness, bleeding, painful bowel movements. And let me clarify, not everyone has symptoms, but these are the symptoms that we need to look out for, okay? Some people may have gonorrhea and they have no idea they have it. So it is important to continue annual screenings. And if you're not in a long-term, mutually monogamous relationship and you're not using latex condoms every time you have sex, you have to go get checked out, okay? Especially if you have any of these symptoms, I need you to contact your medical provider because gonorrhea is serious and your medical providers can further assist you. I want to thank you for watching this segment. This is Victoria with the Miss Victoria's Health and Wellness Forum. Oh yeah, and don't forget, please like this video, subscribe, comment, tag a friend, share it. This information needs to become viral. I love you all. Peace, love, and light.